FIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Hello and good morning all. Hope we're all having a lovely Saturday this morning. So I'm just gonna kick off with the speaker today. My name is Tayo. I'm one of the hosts today. I'm a clinical pharmacist by background. So today's speaker, her name is Dr. Folake. She is a dynamic professional whose journey merges the world of healthcare, business, and entrepreneurship. She starting out as a dedicated family physician. Her passion for both people and strategic ventures has led her into diverse fields where she has continued to create impact. She's also a business founder, strategist, property investment consultant, and public speaker. Today, Dr. Folake will be speaking on a subject that many of us may not always be familiar or consider: how poor housing conditions can affect our overall health and well-being. And it's an important issue that connects directly to how we live and thrive, especially in the United Kingdom. And I am confident that you take away valuable points from this session. Please do listen closely, engage, and be ready with your questions, where we'll move into a question and answer session right after the talk. Without further ado, please join me in welcoming Dr. Folake Yusuff.
Thank you so much, Tayo, for that wonderful introduction. Thank you so much. Good morning, everybody. Thank you for being here as well. Thank you for sacrificing your Saturday morning to be with us on the Health Hour. And the aim here is to try and enlighten us and also me learn from you as well, what our challenges are with housing and how we can improve our health overall through the kind of homes or houses that we live in. So I'm just going to start to share my slides, and I think we're going to do questions and answers at the end of the session. So if anything comes up and you don't understand, just put it in the chat box, and at the end of the session, we will go through the question and answers. So so the topic for today, just to remind us, is your health, your house and your health, and how housing conditions can affect our well-being. So why does housing matter? So housing is just not where we live. It has a lot of effect on our physical and our mental health, and even our social health as well. Through this presentation, I'm going to show you how, as Blacks and minority communities, I know some people don't like that term, but Black and minority communities, we are more at risk due to the type of house that we stay in. And that's why it's relevant for us today. And obviously how our housing can help with our overall well-being. So I've just taken that graph off the www.gov website, and it is from the last uh, uh, it goes up to 2023. I think the last census was actually 2021, but the document goes up to 2023 to show us how the housing market has been in terms of what kind of proportions we're going through with, owner houses. So, people with mortgages, local authority or social housing and private rentals. And as we can see on here, it's not, I mean, the generally the number of people, the proportion of people in owned homes, so either owned outright or houses, hasn't changed that much over time. But as we can see, obviously more people are going, having the mortgage outright, and I'll owning their homes outright, sorry, and I'll show you that in the next graph. But also since about 2020, between 2007 and 2008, pardon me, you've also had this introduction of, social housing, so housing associations, as well as, local authority housing as well. And that also, you can see it's a bit flat. I mean, it's grown a little bit, but it's not that much. And we know from, our localities that the councils are not building any more houses. If anything, they're selling the houses. So you have more of the local authority houses. So they're the social, the charities and everything providing housing solutions for people. The population is increasing, but as we can see, the overall number of houses are not changing that much. So what is happening there? So this is by age, and as we expect, as people get older, they become more of owner occupiers, and then the rental market goes down. Also, obviously, in the middle of that, you've got people who go into care homes in the older years, so the ones that don't have money to own their own homes, or they don't have enough money to privately rent, then they will either go into some form of social housing, or they will go into care homes and nursing homes, which wasn't included in this graph. Now, what was more, sad for me, and I think it's something we all know, but seeing the numbers is the proportion of these houses to ethnicity. So if we take private rented homes, it's not a big deal with the private rented homes. We've got about half of the private renters are, from the Black and ethnic minority groups. So you then wonder, okay, where are we in the other side of the statistics? And to think about it, if we think about it, we make up about 5% of the total population for what I saw. So we have half of the rental houses. So that means, we're in professions where we can then privately rent. We're not needing social housing. Now, this is the sadder one, the social housing one. So again, considering that we 17% of the total population of England is in social housing. However, 44%, that again, almost half of the Black and ethnic minority are in social housing. It hasn't really broken it down to, whether it's the council houses or the local authority, but whichever one, it shows that socially or socio-economically, we are the ones that need more support with our housing, and we are more likely to be the ones to be put in houses that do not suit us, or, we just take whatever comes to us. Owned homes, we're not doing too bad on owned homes. I mean, with 3% of there, so we've got quite a representation in owned homes. So 91% is white. Obviously, white people are the majority in the country, so that's expected. 9% into the Asian community, but obviously they hadn't said what Black is, so I'd had to deduct that for them, and that means we are 3% of privately rented houses. So when we then start to look at, okay, what is the problem? Like, you can ask that, well, yeah, we're in social housing and, local authority housing, what is the problem? Well, as I said earlier, when you're in this kind of houses, you have less control as to what happens to you. You get put into a property, you can't decide what you want to do. If it doesn't suit you, you can, you have to go on the list. We know all the problems that come with this. We're on in temporary housings for a long time, and then they move us around, and that causes a lot of instability and health problems for us. And it's not uncommon for us to see, as GPs, people come in to ask for letters of support because their house is full of damp and mold. They're having, skin conditions, which I've even put on here, asthma, problems breathing, recurrent chest infections as well. You can imagine how that then damages the lungs over time. And I don't know if anybody was aware when there was this issue about a case that actually went to court about a mom that was complaining about the effect of where her house was and how it had affected her daughter, who developed, serious respiratory conditions. And that's the level of problems that we can end up getting. Um, we also end up having houses that are older, so the insulation is not as good. So then people living in those houses are at risk of, viral infections, and that can then, further on cause long-standing damage on the lungs and eventually on the heart as well. Overcrowding is another problem. Now, when I looked at the statistics, which I didn't actually add in here, overcrowding was actually more common in the Bangladeshi group. They didn't really say about the Blacks, so I didn't bother putting here because I don't know what the numbers are. However, we would have, families where they're multi-generational, grandma and, daughter or son and the grandchildren are living in the same home. So it might not be it might not be always, but there are some Black and ethnic minorities as well that do that. And that could be for a lot of things, either for support of the elderly person, or the elderly person is helping to look after the younger ones. Also for the fact that you don't have enough money, so it's easier for them to just live in the same home, and it reduces their outgoing. But again, when you're living in a council flat, then it makes it more difficult for you to decide how big you want the house to be, because there is a limit on the number of, big houses on the market. Those are the ones that will go really fast because all families want to be in the bigger properties. And then we have issues with poor ventilation as well. This causes obviously pests, will grow. So we've got cockroaches, we've got rats, all those kind of things. We've got smells as well, which end up causing problems with the sinuses, and then they get lots of sinus infections. And then allergies. Allergies mainly will be from the mold. So mold can give you allergies as well. And then obviously unsafe homes. And I did a session similar to this before, and I'm trying not to repeat myself. And that was something to look at, the inside the house and how we live, and how clutter and lighting and everything can affect our health. So all those kind of things will help, because if you've got lots of people living in a home, then you've got you've got lots of property, the personal effects around the house. So things will be scattered about. There's not much space to move around the house. You have risk of falls and accidents as a result of that. The mental health aspect is actually very big. Again, as a GP, it's not uncommon for us to get people coming over again because of the mental health effect of their housing conditions. They wake up in the morning, there's no sense of belonging, no sense, low self-esteem. They're not happy about where they're living. It affects their mental health, ends up with things like anxiety and depression. They have all those houses that have lots of mold in it. There's no aeration. The kids don't have space to play. All their toys are in boxes. They can't really move around. The bathroom is full of mold. And we know those kind of houses that look like this. And I'm sure, we have been into those form of houses at some point in our lives. So that also causes problem. The other thing that, that then leads to is also obviously stigma and isolation. And you've had kids who wouldn't want their friends to come to their homes because of the way their houses look. Their parents, the parents as well don't want their own friends to know where they live, so they can't socialize. They can't have birthday parties. You can't have all those gatherings that we like to have, Christmas, Eid, all the kind of gatherings that I would like to have. And most of these celebrations are probably somebody hosts this year, another person hosts the next year. And when it's your turn to host, you kind of back out, or you don't even go in the first instance because you don't want to be the one to host next. And you've also got obviously the social impact of it. So as I mentioned earlier, when you live in, when you're waiting list for a council house, you end up being on temporary accommodation. The council can decide that, for one reason, they have to move you. The kids move around from place to place, disrupted learning. They can't settle down into one school system. They can't build friends. Again, that further causes that low self-esteem and isolation. And I've also put on here a higher risk of abuse. So ideally, obviously, when we're growing up, the kids at certain ages, they need to be in separate rooms. You've got a boy and a girl, for example. You've got, different gender of kids. And you find that because you don't have the space, the kids are living in the same room for till they're much older, or maybe in their parents' room. And this kind of things, or even other relatives living in the houses, so they don't have space. They, because of the condition that they're living in, they're having to stay in the same places. Puts that at risk of sexual abuse. Also, sometimes these kids will go out because they don't want to stay in their houses. Again, it's not any better out of the house. They still face the same problems. Due to the stress and of the living conditions, some of this, parents would also end up on drugs and alcohol, also domestic abuse. Those kind of things are all associated with the kind of places that you live in to some degree. The other thing is people living around you. So again, the kind of areas, how safe are the kids out when they move outside the areas? You have drug users, drug abusers, needles and everything around the house, which can be a problem for the kids as well. Um, Now, strangely enough, even with the statistics, people in poorer houses have higher energy bills. And it's a bit of a paradox because these are the people that don't have the money, but because they're in houses that are not well insulated, in poor heating, single glazed windows, those kind of things. Or even windows broken, doors broken, they put boards up, they put all sorts of things on there. Then they face more challenges with their finances, and they then have to then decide what to do with their money. And I've looked, a lot of the charities that deal with this, they call it the heat or eat dilemma. So that means, do I heat my house, or do I eat, or do I, pay for food? And it's similar with the elderly people as well. It's been all over the news with the, the winter fuel allowance with the older population. When it was introduced, it was found that a lot of elderly people live in cold houses, and as a result, they don't, because they have to either choose whether they use the pension for food or for fuel. And overall, the poorer the condition of your living, the it kind of correlates very well with the inequality. Those two inequalities match, the housing and the health inequalities. Now, a lot of times, when we're picking at home, what are the things that we should then be thinking about? Obviously, the finances is the big one, and there's not much you could do about it. However, even within that financial bucket that you have, there are other things that you also want to then look at when you're moving to a house, a property. So, and I would say this will probably be, apart from over some of the other, aesthetic things that we think about. Some of these things are even more important to think about. So when you're going to look at the house, if you're a private renter, probably this will probably relate more, because if it's a council house, you're desperate for a house, they give you a house, but I'm just going to have to stay in there. So look at the aeration of the house, so things I mentioned, like single glazed windows or double glazed windows. Even though the rent might be cheaper by, I don't know how much rent cheaper by maybe £100 a month, and you think, oh, I've got a bargain. However, the amount of money you're going to use to heat the house up over time might not be worth the amount of money you've saved on the rent, or the effect of your health as well. So sometimes it's not just about, oh, I'm just going to air the house, or I'm just going to clean up the mold. Something might be causing that mold apart from airing. And sometimes the estate agents will say, oh, it's just the last people that were here, they didn't air the house properly. It might not be that. It might just be the balance of the heating is not right, and they haven't addressed that, or they've just put paint over it and they don't allow you, that doesn't allow you to see. So look at things like condensation, damper mold, and see if they've done any investigations for them, and make sure that's corrected. And if possible, don't even rent that house if you had a choice, if you're a private renter. Obviously, ventilation and insulation as well. So ventilation, I think that will probably be more common in some areas of London where, what the landlord has done is, this is supposed to be a big room. They've just put a partition in between it. So one has a window, the other one doesn't have a window. And I know people in London, obviously, housing is very expensive. Sometimes we have no choice. But then you have to be aware of that if you're in a room that does not have good ventilation, that has effect on your respiratory health. Also, if there's no windows, you don't have good sunlight, and that also affects on our vitamin D and our mental health as well. Um, unsafe electric, gas, and fire risk, again, every private landlord should have this checked periodically, and they should have a certification as well. So those are the kind of things you want to be asking if you're going to rent a property. Also, even if you're going to buy a property, you have to have that at the back of your mind as well, to know that even if it's not there, then that's going to be an added expense, and that's something I must either address when you buy the house, and the price you're going to buy it for should reflect that you're going to be spending that extra money as well. Structural hazards, again, obviously, things hanging around, cracks in the wall, things are broken. The staircase is quite obviously most staircases are creaky, but again, loose railings, those kind of things are things that should be sorted out before you move in. Once you move in, you don't have any leverage anymore. You can't complain about things, and they'll just take their time to sort it out whenever they can. Obviously, basic hygiene facilities. I don't think any house in the UK anymore will be. I don't think. Well, I don't know what happens these days, but it shouldn't be on the housing market. It wouldn't be marketable if it doesn't have these basic facilities inside them. But I'm sure you'll be shocked the kind of things that people go through. I've mentioned about overcrowding. Again, it's nice to have family members with you. It's lovely to have, buzzing, I know a lot of African people, we like, the house be buzzing. Once in a while is good. But if that's going to be your living condition going on, then maybe you then have to look at shelling out to buy a bigger property that will be enough for the number of people that are living in those houses. Because I've covered, the problems with overcrowding already, and I'm not going to go through them again. And obviously noise, and I mentioned natural light as well. So just for the time, I'm just going to move on. Layout. The one I like most about layout, and I think I mentioned this in my last talk as well, is open plan or not open plan. Now, our foods have very strong smell. As nice as they taste, the smell is very strong. And that's a balance that you then have to make as a person that's living in the house. Do I want to buy an open plan house where the smell goes around the house? You can't close the windows, or, just between the kitchen and the living area, the smell goes into the house, goes on your clothes. And we know how it is in this environment when you go out and you're smelling of, I'm Nigerian, so you're smelling of, locust beans or egusi, or, those kind of really, strong smells, and how people isolate you and people like look at you weirdly. And it's not really good as well in terms of your own hygiene as well. So that's one thing you should look at. Now the other ones, things like do I go into a flat, or do I live in a house? It's probably going to be personal choice, but you see, you have to think about the access. So, for an elderly person, or if you've got a health condition needing, do they have a lift? Do they have disabled access? Those kind of things should be at the fore of your mind. The other thing is access to outside space. So some high-rise buildings, they should have somewhere around them, but some of the private developers might not do that. So these are the kind of things, again, you want to be thinking about. Do I have access to outside space? It is nice to go out, nice to aerate the lungs, because it just helps our lungs live longer, and our hearts as well. And it's good for your mental health. So that's one thing to think about. Obviously, exercise is a big deal. So again, if you don't have if you don't have outside space, you're less likely to want to go out to do exercise. So like, you've come back from a long day at work, the last thing you want to be doing is, walking another few miles just to be able to get a bit of exercise in. And the social and economic factors, that you want to consider. Obviously, again, one of the other things is, yes, I've mentioned about overcrowding and get the right size of property for the size number of people. But on the other side as well, we don't want to shell out and buy and stress our finances just because we want to own a home. Sometimes it's not the end of the world for us to rent, but it's not worth the financial stress, because then if you've got a big mortgage, then you're working like 3 jobs, and you don't have time for yourself. Your well-being goes down the drain. So a bit of balance in life is quite good. Again, owning versus renting, I mentioned that. I know one of the things we think about is, what if they, I don't want to be at the risk of the landlord, especially had really bad landlord experiences. And there are good landlords out there, but I know there are also the bad ones. So, the risk of eviction, people not taking care of the houses and not doing things to the standard that we would like, versus that sense of ownership as well. But again, you have to marry the finances together. As I said, there are good landlords and there are bad landlords. If one landlord is not good, then we move to another one, or we buy a smaller house that would work for the amount of money that we have. The mortgage people would look at all this before they approve your mortgage, but we know there are ways people go around this to make sure that it looks like they're eligible for it. But at the end of the day, we're the ones that are going to suffer for it. So it's something that is worth thinking about. And then for our ethnicity, we're big on family, we're big on support networks, community spaces, religious spaces, all those kind of things. So again, you don't want to go, so far away from everybody. If you like that, that's fine. If that's the kind of life you like. But again, if that's not the kind of life you like, then it's worth thinking about. Now, there are landlord duties that a landlord has to do for a private rented home. So considering that about 50% of us in private rented homes, I thought was just what puts in on here as well. So they have to have gas safety certificate, and that must be done annually. Obviously, when they come and do the certificates as well for the electricity, any electrical appliances as well, that has to be tested and make sure that it's well, wired and things like that. Smoke alarms. I didn't actually talk on HMOs, which is multi-let properties, so the ones where you rent a room and you have communal space. But again, if anybody's living in those kind of homes, that is priority for the landlord to do. They have to make sure they have smoke alarms and they have to have fire exits as well in designated places. Before they get their HMO license, that would have been looked at by the council. But you still have rogue landlords that will be operating under the radar. Again, your house you might feel like, oh, I've got a cheaper house, but then that you're balancing that with your own health and your life. So again, we have to take these things quite seriously. Any structural repairs is for the landlord to do. So that's nothing you're renting, and that's the joy of renting. You don't have any business with anything structural or any of the electrical anything that is like the boilers and those kind of things is all the landlord's responsibility. And yeah, they will make sure it doesn't have any hazards. Again, people will put this kind of houses on the market, but like I mentioned in the other slide, looking at things like the fixtures, making sure they're solid. And if it's not, then what I say to most people, if you're going to a rented house, make sure it's done before you go in. Once you go in, it's so hard for you to get them to do it unless you have a landlord that is super diligent. And if the duties are not met, the reality is if duties are not met, you probably don't have much room. There are things on paper that you can do, but it is a lot of stress, and a lot of times you end up just moving to another house. Is really usually the bottom line. But whatever communication you have with the landlord or the agent who is representing the landlord, keep a copy of it. So even if you speak to them over the phone, follow it up with an email. As discussed, blah, blah, blah. It's all dated, it's all there. You've got your timeline there. There is somebody in the council that usually should address it, but we know how the state of the councils are nowadays and the government houses. There's so much pressure on them. They might not get to you for a long time. There are charities. Shelter was one of the ones I saw online that actually give support for this kind of problems, and which is Citizens Advice as well. Obviously, sometimes the council itself is your landlord. So, but then the people that are doing the housing are different from the environmental side of things. So they're kind of, same government bodies, but they're different departments. So if the government is your landlord, you still have that room to complain. The question is, what do they do about it? Well, they'll say they'll offer you another property. It might be very far. But I think the essence of this discussion today is to make us aware that it is not just the house. It is not just, it's just a bit of mold, or it's just a bit of not poor lighting. It's a bit of, it's too small for me, I'm fine with it. It's to make us aware that there is the long-term impact of these things on our health. And I've almost finished. I think I've just got a few things. Okay, so obviously as a GP, as I said, we see a lot of people with poor health, health conditions due to poor housing. If you've got any symptoms that suggest, you think could be related, is worth coming because again, people will ask for letters as proof that they're having this kind of things. Most letters will be paid, by the way, but at least you've got that, or you can request your records, which should be free for you. But if you need a letter, then they'll charge you for it. Know your housing rights, as I said before, and then you've got the support groups as well. So the main thing, as I've said over and over again, is the quality of your housing has a large impact on the quality of your health, and like other things that affect the Black and ethnic minority, the more we can address all these little things, the better our overall health will be. Um, and that's me for in terms of the presentation. So I'm happy to take any questions that you might have. Thank you.
Hello, thank you so much for that talk, Dr. Folake. Hope everyone got a few things from it. I definitely did got a few points from it about housing and the importance of it. If you want to put your questions in the chat, I'll ask them to Dr. Folake as well. Natasha is putting some questions that people have asked from other social media platforms as well. So I'll just start if that's okay with you. Yep. So someone says, I'm very intrigued by a point that we take a lot of social housing. I think this is more of the culture of grabbing a freebie or something cheaper than need. People don't think of the other health price we pay later thoughts.
Yeah, I think that's an important thing. I've never looked at the statistics before, to be honest, and until when I was preparing the slides, and I was looking at all the other statistic numbers. I was like, so why are we in more social housing? You're saying as level of yes, socioeconomically, but the proportions didn't matter, and I think that's a good point. A lot of us probably will take it because it's cheaper, and they think that it's a waste of money to go into a private rented house. But don't forget, as you said, there's lots of impact on our health. But even if it's okay for you, what about our children? How do they feel about it? Their self-esteem, their own health as well. So yeah, very good point there in terms of having our priorities right. It's not about, buying houses and, flashy cars and traveling abroad and things like that. The foundations needs to be sorted out. And if we're going to complain that uh, we're at risk of a lot of the health indices. So, everything you look at, cardiovascular health, we're high on that. We need to start taking responsibility ourselves for the things that we can change. But that's a very good point. Thank you.
Yeah, I think it is, especially with the cost of living crisis and the uncertainty about jobs and finances and stuff like that. It is key that we protect where we live as well. Someone made a comment, it wasn't a question, that unfortunately it is impossible to buy a house these days. Like everything is so expensive to deposit. And then sometimes people are just forced to rent in areas that they might not want to.
Yeah.
Um,
Mm.
someone in
Yeah,
the
sorry. Go ahead.
Someone so Natasha wrote, what do you think about modern expensive flats that have no space for everything? It's overwhelming, definitely, to find creative storage ways. Does this also affect our health?
Yeah, I think one of the things that, so I'm going to tie the two answers together. I think one of the things that the statistics showed was obviously the proportion of renters are higher in places like London, which would skew the number quite a lot.
Mhm.
Now, there's something about we Black people in London. I don't know what the love is, right? We don't want to leave London, which is, I understand the sentiment. But if you think that if you're going to, for the same amount of house, so if you're going to, so I live in Leicester, for example, and I totally agree, you know, it can be socially isolating. It's nice to be amongst your people, but then again, it's the balance. So, say in Leicester, if you're going to buy a 3, 4 bedroom house, you probably get away with like 400K for a 3, 4 bedroom house in a good area with good schools. In London, you'd be lucky to get a flat for
Mhm.
that cost. So again, yes, some things are choices, and we have to make those hard choices. We have to decide what is more important for us. Is it the lifestyle of living in London and everything? And London is quite overcrowded as well. So it we have to balance it basically. What do we want out of life and what is more important to us? And yes, like Natasha said as well, this kind of houses, you know, in somewhere else in the UK, those kind of houses would not sell because nobody's living in those kind of houses, or they would go very cheap because they are proper houses, detached, semi-detached houses that are going for that same price. So again, we need to think of what is important. For everything in life is a choice. Unfortunately, I'm going to be brutally honest here. It's a choice. And I understand the sentiment. Sometimes I wish that I was living in London, but I think for what you gain from out of London in terms of the area you live in, the schools your children live in, go to, the kind of houses you get, overall, is it really worth it? And the kid, you can always go and visit London. I mean, it's just 1 hour to London by train from Leicester. You can take you've got National Express as well. Go and the more of us that live outside London anyway, we don't need to go to London because if all your family are coming here with you, then you don't really need to go there. It's nice, it's beautiful, it's got the life, it's got the buzz, but at what cost and at what expense? And that's what we need to think about.
Yeah, definitely. There is a thing with Nigerians and London because every time you say you're going to the UK, that's the first
That's
place.
the first place, absolutely. And it's not just Nigerians, a lot of,
A lot
other
of people, yeah,
Black
that's the first
community.
place
Yeah. I don't know, maybe it's a status symbol thing. I don't know what it is. It's like, that is home. And I still feel like that's home for me. If I'm going to London, I'm like, oh, I'm home, But again, if I had to live in London, I would probably have to do more work. How is that on my mental health? How is that on the stress levels? How much time am I going to have with my children? All those kind of things feeding into our overall health and well-being.
Definitely. So someone left a comment as well as some questions as well. They asked about needing advocate support for their housing, funny enough, in London. They asked about what is your opinion about bathtub for client with joint needs, and does the council consider this as a preference and not essential? There's another question I'll ask, but I just wanted to do it step by step.
Yeah, so if you have knee problems, getting it into a bathtub will be a struggle. So one of the things you can do, one of the things we do as GPs is to then refer you to the occupational therapist, so OT. So they come and do a formal assessment for you, and then they will make recommendations. So if you're in a council house, they sort that out internally. If you're in a private property, unfortunately, they can't do anything about that. So the OT can only come and suggest for you because it's your house, unless you have this, really you know, a conscientious landlord. I don't think any landlord is going to be changing their house for you. Some landlords might do. Let me not say that. Some landlords might do. So if there's some landlords that actually are focusing on people who have health needs and disabled people. Although obviously it's a private market, so whether you find those people or not is difficult. The best way to do it is if you know anybody who is a landlord or goes to landlord meetings, just mention to them, look, I'm a private renter. If you know anybody that does homes, specifically targeted at people with, mobility problems, I'll be interested to rent their house. Because again, it is a good business model. Because if I do my house and it's suitable for somebody with mobility problems, they're more likely to stay in the house longer and they're less likely to leave the house because there's they really don't have any competition out there. The other thing is if you leave, I've created that niche for myself. Somebody else will come in because that's what they need. So yeah, so if you're in a council property or local authority house as well, then yeah, you can always refer to occupational therapist. If you're private rented, they can refer you to occupational therapist, but the best they can do for you is give you recommendations, things you could buy in the house to adapt the house. But unfortunately, the council are unlikely to come and change the house because we need the permission of the landlord to do that.
That's fine, thank you. And when you say private, how so council is obviously owned by the council. Private is like all these like rented apartments or
Yes.
houses
Yeah,
or
yeah. So yeah, private landlords. Yeah. So I have a second house and I'm renting it out.
yeah, 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 yeah.
But then yeah, the government is your landlord, but it's still yeah, a council property.
Yeah, that's fine. The second question that they asked was, can the council provide you a home if you're vulnerable and have only lived in the area for 3 years?
Every council will be different. There is usually a list, and people go up the list there's a queue everywhere, and that's probably what's brought about the recent, uproar about, asylum seekers and everything. So there is a queue everywhere, and there's a backlog. And it will vary from area to area what their priorities are. So the more of your vulnerability tick box you have, it should push you up the list. But if everybody's saying they have those problems, then the queue is just going to stay the way it is. Some people will come to GP to get private letters, and whether it helps or not, I don't know. But it might be worth looking into whether it will help or not. Again, the private charities will probably be a good place to go to. So places like shelter, you can get like independent advice from them. Citizens advice will give you some insight as well, but I think I would prefer going with the charities because then yeah, they're more independent.
And I think you touched on a bit as well. What is your opinion for individuals who need letters from GP? Is it like a seamless process? Do they need to have like evidence to show that they're having issues with their housing? How does the process work for people?
So GP letters are it varies from practice to practice. Most practices will just write it for you, whatever you want to. Like the most of the practices I worked with, what they'll do is they have a form at reception. You fill in what you want, as long as it's reasonable, of course. If you're not, they'll go through your records and see that you've not said you're disabled and yet you're not disabled. So they'll do just quick, basic fact checks and everything. Now, a lot of the things that, unless it's objective, so say like you've got really bad allergy, for example, and you're on EpiPen or you're on some skin conditions and everything, which is that's more objective. Subjective things are like, oh, it's affecting my mental health, or I'm feeling suicidal because I'm living in a poor house. Not to say it doesn't happen, but nobody can prove it happens, right? So those ones are more subjective. So your letter will go along the lines of something like, they tell me that they have been, it's affecting their mental health, because I can't say 100% that that's the case, and we know that some people will play these tricks, unfortunately, which is making the people who really need this help to be pushed back. So but if you have a straightforward, I've got a skin condition and it's likely to be due to mold, or it's likely to be due to this, or you've got mobility problems, then yeah, that they will just write, oh yeah, she uses a wheelchair and she can't climb the stairs. Her house is on the first floor. Can you look into her house and everything like that? Most GP surgeries, almost all GP surgeries, unfortunately, you have to pay for your letter because letters are not core work of GPs. So we're not there to write letters. We're not there. It's just because of the way the social, situation is. And that's why we're being involved in these things that we shouldn't really be involved in. So somebody has to take that time to actually look at these things and all that. So it's really just the money to pay for the admin time. It's not even really to pay for it. It doesn't really pay your time, to be honest, for the price that a lot of the GP surgeries request. In fact, some GP surgeons will say no because it's just a waste of their time. And like, look, you need to find another way of solving your problem. Unfortunately, we just do not have the manpower, the capacity. So it's going to be an individual surgery decision. Some other people will be asked, they can get somebody else to ask for them. So they have advocates and, support workers and key workers. If you have got, really, really bad mental health problems, you might have a support worker and key worker. They will be able to guide you as to what to do and how to go about these things. And you might be able to have some exclusions from pain and stuff. But most times you would have to pay because it's not a clinical need per se.
Oh wow, I didn't know you have to pay, but I guess that makes sense because it's more of a social issue rather than a clinical issue as well.
Yeah.
But I guess like for people who are wanting to go down that line, at least they have a rough idea of how to the step.
Absolutely. And so I was just going to say again, because of because health and social care now, merged together for a few years. So a lot of surgeries would have a social prescriber. So they might be based on the surgery or they might be based in the locality. So again, before GPs will have to sort out all these things. Now, if you come and to just say, I just need an appointment with a social prescriber, you don't really need a GP appointment if you don't need to have one, because we know how difficult it is to get there. If you just tell them at desk, like, I'd like to be referred to a social prescriber, you know, they can help. So apart from charity, social prescribers can also help with these kind of things as well. So they know what is available in the community, and not just for housing, any other chronic health problems that you have that has a social element to it. So they know what support groups are there, who can help you with, with this, even with finances, mental health problems, all those kind of things. So that's just a plug for social prescribers as well.
Yeah, so it's like an interlink of like everything in
Yeah,
between.
so where health meets social,
Yeah,
basically.
yeah,
Yeah. For
yeah.
people that have been off work for a long time as well. So some
Mm.
surgeries are beginning to do that. So if you've been had a sick note for a long time, then social prescribers are beginning to look into it, especially for mental health problems, and seeing where they can support you.
Yeah, it's a whole, unfortunately, it's just a whole big issue. And because I don't think they have like there's been a backlog. So it's been shifted to different professions that normally wouldn't, unfortunately, take this, but it just has to be done. I guess like a final question before we wrap up. From your medical perspective, what are some of the most common health issues like you've seen linked to poor housing conditions? So maybe when people come in and then they're unaware that because of where they live, this is what's, I guess, causing the conditions that just in case anyone's going through something and they can just pick that up.
The most common one actually that I see is respiratory conditions. So recurrent chest infections and asthma-like conditions, they're the most common things. Some of them will have eczema as well. Eczema is not directly linked, but indirectly can be. And then the one that has another big impact is mental health. So again, they just keep, people keep coming in and I mean, most appointments are 10, 15 minutes, but sometimes you build that level of rapport with the patient and you actually start to ask these questions. I say, oh, I've been fighting with the council forever to try and do this. My child got into bad company because of our neighbor. The neighbor shouts a lot, doesn't let me sleep. My neighbor is a druggie. He's, or she is threatening me. Those kind of things, we see that as well. And it causes a lot of, really, really bad mental health problems. And I've actually had somebody who couldn't leave the house due to anxiety because of the neighbor that was next door. Now, because a lot of these things ends up being anecdotal unless you have like a CCTV camera, which is why it gets to that level, that the mental health, you then start doubting yourself, like, am I crazy? Like this person actually is doing this to me, but there is no evidence or proof that they've done it to you. So even when the police come, if they don't agree that they've done it to you, then you're in a difficult position. So the mental health impact is really, really big on poor housing and lack of that flexibility. Because if you could move, then you just move to somewhere else. If you're a private renter, for example, you don't like where you're living. I mean, for simple things, I don't like where I park my car. You move your house to somewhere, you move somewhere else. But if you had no choice, if you're in a council house or, what you can afford is for a particular area, or you're an elderly person, which is another big one I didn't actually talk in this, the elderly people is another one. I think this person was actually an elderly woman. She couldn't leave her house anymore because of her neighbor, and the council would not move her because they say, the neighbors connived and said she's the one that had the problem. So yeah, so mental health is a really big one. So if you're going through a lot of stress and you think, oh, could it be it? It could be. It's not. It is a big deal. And the other one is the breathing problems as well.
Thank you so, so much for your time, for your answers, for your knowledge, Dr. Folake. I hope we've all learned a few things. I know I have the process of maybe going to your GP for all these social health issues. And if anyone's facing it, the charities that you mentioned, I think I've forgotten the name that you said,
The
Doctor.
shelter, the other ones as well, but shelter is the main one that keeps coming up. But shelter are very useful for people like especially if you've got like risk of homelessness or temporary housing, they're very good for that too. But they've got a big input now with the temporary housing community as well. So if you're at risk of losing your house or temporary housing, you don't have anywhere to live, risk of homelessness, shelter would definitely be 100% where you'll go to.
Yeah, that's fine. We'll post the link on the chat. But yeah, thank you so much, everyone. I'll be handing it over to Shola just to wrap up and let us know about any subsequent events as well. Thank you so much.
Very many thanks, Dr. Folake and Dr. Tayo. Just give me a second while I try to load up my slides. I don't know if you're able to see it now. No? Okay, great. Right, so I have to say thanks to Dr. Folake and our host Tayo Ayeni for giving us insight into today's session. I really, really appreciate it. Also, I must mention, because Dr. Folake sort of discussed the idea of people having advocates that might be able to write letters for them. So we do have an advocacy service within Khan, where if we've been working with you for quite some time and we do understand some of these things, we might be able to sort of like assist with such letters. So if that's something that you might require, please get in touch with us and we'll be able to sort of like help you with that as well. So just as we've had a brilliant session today with Dr. Folake, we do host Health Hour every single Saturday, and next week we are hosting an health hour called Self-Care is Not Selfish. So exploring how to sort of like take care of your well-being, and we'll be joined by Dr. Anna Bru. So please, to register, email info@can.org.uk. It's again at 11 a.m. to 12 p.m. Next week, Saturday the 27th. Also, Black History Month is just around the corner. So we are hosting as Can a Black History Month celebration and awards gala, to prestigious Black tie event. It's going to be held at the Concord Conference Center in Manchester. It's on the 11th of October from 6:30 p.m. till late. So if you're looking to celebrate, the work of, just celebrate Black History Month and, some of the great things that Can and also some other organizations and individuals within the Black community have been doing. So please do join us. To get further information, please email events@can.org.uk. We hope to see you there. It's going to be a lovely time to celebrate with Can and the wider Black community. Right. We're also inviting you to our Black History Month Civic Lunch event, which is going to be happening in the monastery in Gorton, still in Manchester as well. It's about commemorating 80 years of Pan-African and Caribbean resilience in Manchester. There's going to be time for socializing, powerful speeches, and also showcase of, a fashion showcase and networking with community and business leaders in Manchester. Please reserve your place today by scanning the QR code on screen, or you can contact bhm@can.org.uk, to learn more about this as well. It's happening on Thursday, the 25th of September, so this month, and the doors open at 6 p.m. At this civic lunch event, you will be able to showcase your work if you're a local business, community group, a charity, social enterprise, or just an artisan, and you want to showcase your work to the wider, Black community. Please do get in touch. We have stalls that you might be able to get and to boost your brand's visibility and also to represent your brand at this Black History Month event. You can contact events@can.org.uk or bhm@can.org.uk to reserve your stall at this civic lunch event. Also, the Black Health Improvement Program. When Dr. Folake was talking to us, she highlighted some of these indices, that sort of like falls within the Black community, about how we are higher, we are at a risk of, we're at a risk sometimes of, in terms of the Black people, of, being. You mentioned, Dr. Folake, about the indices that affect Black people in terms of health. So we have this Black Health Improvement Program that is for primary care staff across Enfield, where you can achieve CPD accredited sessions to improve cultural competency and equity among your healthcare practice. So if this is something that you might be interested in, please do contact us at bhipenfield@can.org.uk to organize a session where you might be able to sort of like raise cultural competence within your practice. That's run by the Can organization as well. Calling up parents of children aged between 10 to 18 years old, the Can organizes a boys club and also a girls club, and we run sessions on financial literacy, mental health, basketball, and all of the other various activities that might allow our children to stay confident, stay active, and learn valuable life skills. So if you've got children aged between 10 and 18 years old, please do get in touch with us, and we'll be able to sort of like put them in touch with some of these various activities that we run within the Can organization. You might be able to register by scanning the QR code on screen. Right, the advocacy team is running an Empowered Voices panel on the 24th of September to explore the far-reaching impact of domestic abuse, not only on survivors, but also on the children who might experience trauma within this environment. So if you're interested in learning from panel members that have lived experience of domestic abuse, please do register by emailing advocacy@can.org.uk, and you'll be sent the link. It's an online event happening the 24th of September between 4:30 p.m. to 6 p.m. Advocacy@can.org.uk is the email to contact for this event. Thank you very much for joining us today, and we must say thank you again to Dr. Folake and Tayo Ayeni for delivering today's session with us. Thank you very much.
Thank you for having me.
Thank you all.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.